Hello again. How are you feeling today?
I'm feeling well, thank you.
Good. So I called you in today. I just wanted to talk to you about what we've been going over the last couple of weeks about your lupus diagnosis. And I have this pamphlet for you. Just kind of has some information about what we're going to talk about today. So you can bring it home with you. So I'm going to give you that.
Thank you.
And I just have some notes here just about some of the stuff I want to talk about so I don't forget anything. But so let's see. So your doctor diagnosed you with lupus, and I know you guys talked about treatment options, and he recommended steroid treatment, but after going over some of the side effects with you, you decided that that really wasn't the best option for you, and you wanted to try some more holistic approach, correct?
Yes.
All right. So over the last week or two, we've been talking about like diet and exercise and stress management techniques. So I just really wanted to go and put everything together for you today so that we can set some goals. So goals for diet, goals for exercise, and stress management. So, and I just want to give you a quick overview of just what lupus is, just to refresh your memory. So lupus is an autoimmune disorder, as you know. It can affect really anyone at any time in their life. Typically, it most affects women, usually from 40 to 60 years old. And it usually comes and goes. You can have no symptoms, and other people can have severe symptoms. So, so what's happening is your body's immune system is hyperactive, and it can attack healthy tissue, and it can have side effects anywhere from swollen joints to chest pain, fever, loss of hair, mouth ulcers, and just general inflammation or fatigue, which I know that you've been expressing, that you've been feeling the joint pain and then just overall fatigue. So you talked to your doctor about your steroid treatment. So I wanted to just kind of go over first our diet plan that we've worked out. So I wanted you to think about really just what type of comfort foods you have in your life that you know aren't probably the best thing for you to eat, but you can't really do without. For me, it's Mexican food. I love it. Can't get enough of it, but it's something that I can't eat every day. It's high in fat and salt and high in calories. It has really no fiber in it, but it's something that I didn't want to cut out of my diet. So what's something like that for you?
Macaroni and cheese.
Excellent. So it's one of those foods that are amazing, but you can't have it every day. So I want you to try and limit your intake of that type of food. You don't have to eliminate it completely, just reduce it. It'll just promote a more healthy diet. So one of the goals that I want you to implement in your lifestyle change is intake of fruits and vegetables. So the USDA recommends that that for a woman your age, eat 1.5 cups of fruits and 2 cups of vegetables per day. I know that doesn't always happen, but it's a good goal to strive towards. So what I want you to do is begin tracking your diet in an app of your choice. There's a lot of apps available. I recommend the MyFitnessPal app, but you can really use any one, and just be logging in all the food that you eat, and especially the fruits and vegetables, so we can try and keep track of that. So I want you to try and meet those recommended dietary amounts 5 days a week. I think you can do that?
I think so. That sounds manageable.
Good. So another part of the diet that I want to try and implement is I need you to avoid certain foods. So certain foods like garlic and alfalfa sprouts have been associated with increased immune responses, which for most people, that's a good thing. But for people with lupus, that can complicate their lupus flare-ups because of the immune response. So it's a good idea to minimize your intake of those. Now, you don't have to completely cut them out of your diet, but small amounts are okay, but large amounts are really not going to be a good thing. And I was looking over all the supplements you take, and I'm not really worried about this, but they do recommend to reduce melatonin and echinacea intake, which just want you to keep that in mind if you ever want to take additional supplements. Just make sure you read the labels and just keep that in your mind, and not to avoid melatonin and echinacea. So next thing I want to talk about is exercise. I don't think I really need to tell you how important it is in life. I mean, there's countless benefits, increased metabolism, weight loss, just increased energy in general. So in regards to your lupus diagnosis, there's really no direct evidence saying that exercise is going to improve your symptoms, but it's definitely associated with co-occurring conditions like heart disease and obesity and just overall quality of life. So a goal that I have set, which I hope that we can achieve, is I want you to do 45 minutes of physical activity of your choice 5 days a week. So that can be anything from walking your dogs to going to the gym. What kind of activities do you like to do?
I enjoy walking my dog and riding the bicycle at the gym while watching TV.
Those are perfect. So I want you to try and do at least one of those activities 45 minutes a day, 5 days a week. And to kind of keep you honest, I want you to be recording those as well in the FitnessPal app or whatever app that you choose to use. That way we can kind of track your progress, and it'll give you kind of a way of looking back and seeing what you've done. And the last thing I want to talk to you about is stress. So again, stress is a huge part of everyone's life. As far as lupus goes, again, there's no direct scientific evidence that stress causes lupus flare-ups, but it's definitely been associated with an increase. So stress management is extremely important. Our goal is to really reduce overall stress, whether it be physical or emotional or mental stress. So I know that we talked last week about how much you like spending time with your grandkids, and then you cited that as probably your biggest stress reducer, right?
That's right.
So I wanted to make a goal where you spend time with your grandkids at least 4 times a month. That'll give you time to kind of unwind and take some time for yourself. I know that you'll enjoy it and your grandkids will enjoy it. Is that something you think you can do?
Sure, I like that goal.
So that's a goal you don't really need to write down, but just whenever you're feeling stressed, just kind of keep it in mind. Be like, oh, maybe I should spend some time with my grandkids. Maybe that kind of reduce my stress. So to recap, so your diet goal: eat 1.5 cups of fruit and 2 cups of vegetables 5 days a week, and then record all that in your MyFitnessPal or whatever app you choose. Exercise 45 minutes a day, 5 days a week. Also record that, and spend some time with your grandkids about 4 days a week, or however you can fit that in, just as a stress reducer. One other thing I'd like to talk about is sun exposure. While it's been associated that sun exposure can increase lupus flare-ups, which and so the doctor has told me to notify or to let you know that to wear sunscreen whenever you go outside, or to just kind of wear a long sleeve shirt to minimize your sun exposure. I think that's about it. Do you have any questions for me?
When we check back in a month, if I reconsidered going on medication, would that possibly still be an option?
Oh yeah. So our plan is to have you start these goals beginning Monday next week, and then after a month has gone by, we want you to come back in. We'll look at your logs for your food and your exercise, and kind of reevaluate what's going on as far as your lupus symptoms, if they're getting worse, if they're getting better, if you had any problems, and go from there. Really, we'll see if the steroid option is going to be a better one, or whether everything's going good and we'll continue what we're doing.
Okay.
But so I should see you in about a month.
Sounds good. Thank you.
Right.